get used to the feel of your breast. Breast self-examination is the examination of the breast by the woman herself. You'll be familiar with her breast, which I've already mentioned, and it will be found that a high percentage of lumps can be detected by women themselves if you do this regularly. And BSC should be done 5 to 7 days after your period, when the breasts are less tender, less engorged, so you can feel properly. And for those who are already menopausal, that's those who have stopped menstruating, you just pick a particular day of the month. It takes only 10 minutes. You can choose maybe the 3rd of every month, or your birthday, 15th or 16th. Just make sure every month you pick a day. But if you're menstruating, it must be 5 to 7 days at least after your periods. And the first step is that you have to undress, and then you look at the mirror with your hands by your shoulders straight and with your hands on your hip. What are you looking out for? Remember that we said breast cancer can come in form of change in size, change in shape, retraction of the nipples and all that. So if you know what to look out for, then you'll be able to do your breast examination correctly. Because I've had situations when I ask women, do you do your breast examination? They say, oh yes, I do it. How do you do it? They just poke there, having no idea of what they're actually looking for. So for you to do your breast self-examination properly, you must know what you're looking out for. First, you must the size of your breast. You're asking yourself, are they the usual size? Are they the usual shape? Are they the usual color? Remember, breast cancer can come in form of change in size, change in shape, change around the skin. And then you ask any visible swelling, any pimpling, poking, all the things we have talked about. And then nipple changes. Are these, look at the nipple, are they the usual position? Ask yourself, any redness or soreness around this, or swelling around the nipple? So these are the things you look out for. This step 2, you raise your hands up again. You look out for the same changes. Because what happens is that if something is going on in your breast, as soon as you raise up your hand, there will be a change. Usually, whether you have your hands on your hips or raised, the size and shape should be the same. But when you raise your hands up, and then there is a change or distortion in the size bend, it's not very normal. And then you now squeeze your nipples to find out if there's any discharge. And in the process of squeezing your nipples, you also want to feel whether there's any thickening around the nipples. And then you also lie down and use your right hand to feel your left breast, and then your left hand to feel your right breast. You see, it's a lot easier to do this. Because when you ask some people, they say they just do this. No, it's easier this way. And then you use this other hand. It's easier, not easier. And you use the paw, these 3 fingers, not the tip, the paw, the 3 fingers, and you go different level of pressure. The first time, the second time, the third time. And then if you have very big balls, you can put your hand under to make sure that you feel it enough to get it close to the bone so that you can really feel it. And you start from your collarbone to your brow line and to your armpit. You go round, you can decide to go round, or you go up, down, but you must cover every point. You can do that while you're lying down. That's the step 4. You can do it when you're in the shower, but most times it's easier, it's smoother, and you can feel properly. Otherwise, you can apply the powder on the breast. And thank God we also have this breast check. It's quite sensitive. So it helps you to detect if there's any lump or any change in your breast. better. So in summary, if you're doing a breast self-examination, you're looking at what do you look out for: breast lumps, changes in the size, openings, scaliness around the skin, check the nipples, are they the same, is there any discharge, any nipple retraction, any thickening, any inflammation or escalation. Some people, in fact, sometimes breast cancer, with a kind of sore, persistent. You have treated with everything and it's still there. Please, you must see your doctor. And if you find any of these signs or symptoms, please do not ignore, even when they appear to have disappeared, and avoid self-medication. Consult your doctor and insist on a thorough examination, and seek a second opinion if you're not satisfied. Remember, it's your life. Because sometimes they say, oh, don't worry, but if you're not convinced, please go to another doctor. And then the next is clinical breast examination. This examination of the breast by your doctor or a nurse who has been taught to do so. And you start it every 2 years when you're above 35 years. Remember, we said as you get older, age, the risks are higher. And every year when you're 50, twice a year if you're a high-risk individual, maybe you have a strong family history, or you've had a lung or something previously, you do it regularly. And then the third one for early detection is mammography. This is a special test that detects extremely tiny breast lumps, even before they can be felt or develop symptoms. It's also used for diagnosis of breast cancer for those who already have symptoms. So it's very, very important. And we have the same here. So you should have a baseline of first mammogram done between the ages of 30 to 35 years. You have a baseline 40 plus. And every 2 to 3 years, if you're 40 and above, or 40 or 50 and above. And for those who are at high risk, you can do it more regularly as recommended by your doctor. I have already mentioned this. For high risk, very high risk, they have to take extra steps. You can go for genetic counseling, especially for those who have very strong family history. You go for genetics testing. You have some drugs that are said to reduce the breast cancer itself, tamoxifen and all that, but then preventive surgery, which we've already talked about, they must take additional care to avoid extra risk. So that's briefly on how to live pink, thinking about breast cancer. But remember, we said that in breast cancer we have those controllable and uncontrollable risk factors. And so for you to live green means you have to focus on the controllable risk factors. And that's how to live green. By making healthy choices that will help you reduce breast cancer and other chronic diseases. And what are the components? Good nutrition, we talked about it, physical activities, stress management, and periodic evaluation. Maintaining a good lifestyle generally. You must avoid obesity in all its forms. And how do you do that? You maintain a healthy weight and stick to it. Not the yo-yo diet. And I know it's difficult. I even struggle all the time. So you avoid empty calories. Avoid high calorie foods, drinks. They offer little or no nutritional value. Just as we have already been told, before you eat something, ask yourself, what do I benefit from it? What's the nutritional value? You begin to ask questions. That's what information or education does for you. And as you take each meal, you just take it as an opportunity to eat nutritiously. Avoid junk food as much as possible. Unhealthy diet. This person, for example, she had salad there, she had rice there and chicken. Well, it's supposed to be balanced, but you look at the portion size. So you must also think of the portion size, and then the type of food. These are all processed, which we've already mentioned. And then you learn to eat smart, know what to eat. If you're taking a bottle of Coke, there's the quantity of sugar you're taking. Sorry, Coke, I don't need to, but this is it. The number of calories empty. When you look at the grape here, it's about 4. It's quite nutritious, has some antioxidants, and it's good for your health. So you must think, you must eat smart, learn to eat smart. So how do you eat smart? You've already mentioned that choose food from the different food groups, as they have already mentioned. Then you go to them. Make sure you eat a balanced diet, work with that. Balanced diets that has the nutrients and you have the energy, the nutrients, and depending on what type of job you do anyway, if you're very sedentary, it means that you really have to take extra care to choose what you eat. Learn to eat smart. An apple, that's the quantity of sugar. For those who are diabetic, they say you should eat a lot of fruits and vegetables, but when you're doing that, you also have to think of the portion size. Then cooking tips. You have to boil, grill instead of frying. I know most time, we are used to frying. We must fry all the time. Fried yam, fried chicken, fried stew, everything fried. But when you want to eat healthy, you need to choose. You need to cook consciously. Don't just cook, especially when you're getting older. You're trying to watch your food. You don't just eat, you have to watch what you eat. Especially sometimes, I eat a lot of vegetable, but if you're cooking a decaid corn and then you add half bottle of palm oil, then whatever it is has been defeated. The calorie is now higher than what you think. Don't overcook, and then prepare your food hygienically. The next is the physical activity. You must be physically active. They've already said it. Even when you do all the dieting, and you don't exercise, then it's so difficult to lose weight or maintain a healthy weight. So the two go together. When you decide to walk, you don't need to have any structured program, maybe go to the gym, but your everyday chores. If you have a house help, you don't let her do all the sweeping, and once in a while you help. You do quite, move around. Even when you want to go and visit your neighbor, instead of using the car, especially if they live close by, you walk, learn to walk. There are a lot of different types of exercises you can indulge yourself in, stretches and all that. Of course, tobacco. You must avoid tobacco, whether it's cigarettes, snuff. I know in the villages they take snuff, pipes, and then don't be a passive smoker. Tobacco is not good. We've already heard it can cause, apart from breast cancer, different types of cancer, all sorts of complications, respiratory, cardiac, and all that. So we've already seen this. See all the toxic things that you find in the cigarette. Most of them are carcinogenic. Alcohol use, all types of alcohol. I know some will say, I don't take beer, but I take stout because it's bitter. And people think that it's non-alcoholic, but it is. So you must know that whatever you're taking, even the wine, the beer, you must know what to take. That's it. And drink less. If you must drink in moderation, because it will also help you maintain a healthy weight. And then stress. Stress is also important. Every day we're all running over the place, trying to meet a lot of appointments. You put yourself into a lot of stress, you're not sleeping well, so it's important for you to have rest. So make sure you reduce your stress level as much as possible. So these are things you can do to reduce your stress. Spend quality time with friends, pets, and not to put self-image, be optimistic and be content, of course. So that's about it. Thinking pink and living pink. So thinking about yourself, breast examination, being breast aware. Breast awareness is about taking charge of your health. Just 10 minutes in a month can save your life. Do your breast examination as you get older, especially for the young girls. You must learn to do it, start from now. Because the problem we are having is that when you tell most women how to do the breast health, you tell them about breast health examination, they don't want to hear it, that they are looking for cancer. But if they have started early enough as young girls to do that, they have become part of it. So part of our outreach to go to secondary school, teach the senior secondary school girls on how to do the breast health examination properly, so they get used to it. Just part of taking charge of your health. It's not that you're looking for cancer, but you're getting familiar with your breast. And then living green, that's the thing. Live green, live green, healthy lifestyle. But one of the causes of breast cancer, increase in breast cancer incidence, is that we are beginning to adopt the Western lifestyle. Even in our homes, all we need, we are eating pasta, noodles, indomie. In fact, the children, even childhood obesity is a risk now. Most of those children were overfeeding, call them whether they're poor or whatever, but you go to most of these schools, you see very fat children. This is not healthy. You must start from that young age to teach them to eat right. Indomie in the morning, indomie in the afternoon, non-fortified meat is not healthy. You must make sure they eat healthy. You start from there, so that they get used to it. I want to thank, although I'm part of the organizers, but I must thank Dio specifically, because the first time I met her as this woman, I mean, why would she, over the years I've met some people like, I just want to be on my own, I don't want to talk about, my issues. But both of them, they have inspired me so much. And I want to just thank them for being such a blessing to humanity, because it's not easy, and they have been the one to get all this together. And I want to say once more, thank you very much, and God bless you.
Thank you very much. Thank you, Dr. Oko. Turn to your neighbor, say, neighbor, think big.